Okay, so permanent sterilization is our last topic under the subheading of contraception. These are surgical procedures. Tubal ligation is the one that is for the female partner. And what they do, they grab the fallopian tubes. It's easy to do this during postpartum when the uterus and tubes are enlarged, but it can also be done irregardless under laparoscopic surgery most of the time. So they grasp them, then they cut them, and then they either burn them or they apply clips. Cautery is probably the thing I've seen the most, and it's a little more effective. Sometimes clips can cause some damage. It has no impact on ovulation or menstruation, so it does not impact libido either. That's a fallacy that people have. It just kind of puts a barrier between the sperm and the egg again. Explain to the patient about the procedure and what they can expect during and after. Reinforce education about permanence of the procedure. You could get pregnant after a tubal. Sometimes the tubes will reanastomose, so with newer techniques they typically don't. There was some experimentation with trying to reverse it by reattaching the tubes to one another, but it is a permanent procedure. If you wanted to become pregnant after this, you would have to have IVF. Make sure that informed consent is on the chart and that the patient understands what they signed, particularly for patients who do not speak English as their primary language. You can witness the consent, but it's the provider's job to have the conversation and obtain it. Now, for patients receiving Medicaid, it's very important that you give them time to back out, because historically, women were sort of coerced into this procedure and they were living with regret. Now, a patient should be NPO 8 to 12 hours prior to the procedure, just like most surgeries. Post-procedure, if you're caring for this patient and if they went out on general, you're going to look for all the things that you would look for general anesthesia. Swallowing, gagging, spontaneous breathing, all of those things. Level of consciousness before you discharge them. If the patient had spinal anesthesia, monitor their legs to make sure that they can bear weight and move before you get them up to walk. You check the dressing. It's usually like a little Band-Aid over a tiny laparoscopic incision. I've seen providers use Dermabond, which is kind of a glue, but some will use gauze or a Primapore, very small one. You check that for bleeding. It's uncommon, but it can happen, and assist with pain relief. You can put an ice pack on the site. You can give them pain meds. All right, on to vasectomy, which is actually the simpler procedure. Remember the first video where I showed you the vas deferens, the tube that carries sperm from testes to the urethra, is cut with surgical scissors. It is a very minor procedure because the testes are on the outside of the body. They only have to make a very tiny incision into the scrotum to grab the vas deferens. It's usually performed under local anesthetic in a provider's office. They usually do it on a Friday so that people have all weekend to recover. Has no impact on sexual function. It does not impact the release of semen. It just means that no sperm are going to get to that seminal fluid. Recovery is quick. It's usually 2 days. It's highly effective, less than 1% failure rate. It is much less invasive than tubal ligation. Pre-procedure, same things. Informed consent, get a health history, and educate that this is permanent, although some men have been more successful having a reversal procedure. It's really not a guarantee, and it won't work for most people. They need to go back to the office and provide a semen sample 3 months post-procedure and 1 or 2 months later to make sure that there are no live active sperm before they can rely on this method for contraception. Post-care, ice pack on the scrotum, sleep sitting up in a recliner chair, mild pain relievers, usually ibuprofen is enough. This does not prevent STIs, so if this man has multiple partners or he's not in a monogamous relationship, he should use a condom to protect himself from that.